Hey, DNA. Kate Wilson here with another episode of All Access DNA. In today's episode, we are talking to Kaitlyn Brown, she, they, about intersex advocacy and the genetics of sex development. Kaitlyn has been an active advocate for the intersex community and people with differences of sexual development and assisted in care management as a former pediatric genetic counselor and researcher. Recently, the Department of Health and Human Services updated their definitions of biological sex following President Trump's executive order. Now, the department states that there are only two sexes, male and female, and that women are biologically female and men are biologically male. I can say as a genetics professional, this is scientifically incorrect and honestly flat out wrong. We discuss the definition of intersex and transgender, impacts of current legislation, and ways to support the intersex community. Let's get started. Thank you so much for joining us today, Kaitlyn.
Pleasure to be here.
First, I wanted to see if you could tell us more about your advocacy for the intersex community and people with differences of sexual development.
Yeah. So I guess it would be helpful to tell you a little bit about my background, how I came to this work. So my undergrad was really focused on philosophy and the ethics and morality around sex and sexuality. So that really got me interested in thinking more about the science behind sex and gender identity. And that introduced me to a group of people called the Turnham Men, or a small group of people from the Sambia nation of New Guinea that have a difference of sex development in which they present looking very female at birth, and they're born with XY chromosomes. And when they reach puberty, their bodies are able to start responding to a stronger form of testosterone. So they start to masculinize. And in this Turnham men society, in this Sambia society where these Turnham men grow up, they're actually accepted and kind of identified at birth. And so they undergo a very different socialization around gender and identity. And so that awareness of differences of sexual development or intersex conditions is what really got me interested in genetic counseling to begin with. So I began listening to a lot of people who identify as intersex or have been born with differences of sex development to really understand what are the concerns within the community. And I became very vocal about talking about the genetic aspect of this with other healthcare providers. So I've done a lot of grand rounds presentations. I've done a lot of educating in institutions that are teaching healthcare providers, students about these issues and how we can better serve these populations. And it's also led me to engaging with legislation and policy around awareness and education about intersex conditions and the needs of that community. So that's kind of where I've been involved in advocacy and really just amplifying the message of intersex people and their needs and the people that care for them and what their needs are.
And that's a really fascinating journey because I think we've heard from a few other folks how they've come to the profession of genetic counseling, but to come from more of a philosophy or ethics-driven background, I think just shows that there are those paths to working in science and working in healthcare, and to be quite honest, are a very needed area. So for people that have that expertise. One of the things I know that you have talked about, and I've seen in some of the abstracts or some of the talks that you have given, you talk about using a trauma-informed lens to educate about sex development. Can you tell us what that means and why is trauma-informed care so important?
Yeah. So I really focus on trauma-informed care because the history around management of intersex conditions has been really fraught. There's still in the history as well as current day, there's a lot of patient and parent regret around the management of these conditions. And so I really like to focus on The definition around trauma-informed care uses 6 key principles, which I think really align with the needs of the intersex community. So it's about creating safety, both physical and emotional safety, empowering the patients and giving them choice, which is something that has historically been taken away from intersex individuals, particularly infants born with ambiguous genitalia. It's about collaboration, so engaging as a team with your patient as a caretaker, being trustworthy. So I think having a lot of honesty about what we do and don't know when it comes to differences of sex development, sex determination, how gender identity plays into all of these concepts, and just being honest about what our limitations are at this time. It's about recognizing diversity in the lived experience of patients. And so it's also recognizing the historical context in which we live in, the historical, the social, the political context in which we live in. So it it likes to include trauma informed care, really focuses on being aware of gender issues, racial issues, and how those things, while maybe not directly related to an intersex condition, can exacerbate issues that are experienced by these communities. And it also focuses on peer support. So, again, looking at that lived experience and really valuing what others who have come before us have to share. And so with the management, the historical management, which used a lot of protocols that are very aligned, very similar to conversion therapy.
Hmm.
And we know that that is really fraught with being unsuccessful, causing further trauma and harm to individuals, and really forcing a certain socio-political viewpoint onto an individual despite the fact that their biology defies that belief. So
Mhm.
I think when you look at it that way, coming to it from a trauma informed lens is really helpful at reducing that potential of exacerbating or causing further harm, which many of these individuals have already experienced.
I think that's helpful to have that lens and that perspective. And it wasn't something I was as familiar with. So I appreciate you sharing us and kind of putting that background to it. Perhaps we've jumped ahead, but I do want to talk about defining the terms, because one of the things I find out when I have conversations with folks from the general public is they don't necessarily understand the nuances, or that terms that they might use interchangeably are drastically different for those of us working on the healthcare side. So, what does the term intersex mean? And can you tell us how that differs from the term transgender?
Yes. So, intersex, or differences of sexual development, or some people refer to it as disorders of sexual development. There's a range of different names. I like to use interchangeable phrases to let people know that there's a variety. So, sex trait variations is another term that I will frequently use. But ultimately, they stand for an umbrella of conditions or presentations in sex traits that are different from your typical expectation for male or female as defined by Western medicine. So that can be differences in your sex chromosomes, your sex hormones, your gonad pathology, your external genitalia, your secondary sex traits. There can be a lot of variation. So there are over 30 identified intersex conditions or differences of sexual development that we have causes for. There are many others that we don't. Ultimately, these are something that an individual is born with in their biology, and it is something that could present at different times in their life. So it may be noticeable at birth. It may go unnoticed until an individual is meant to be experiencing puberty, and maybe something is not going the way it was expected, or they may find out when they're undergoing fertility evaluations or planning to start their own families. There's really a variety. And in some cases, people may never ever know that they have a difference of sexual development. In some cases, there can be serious health concerns that are associated with these differences, and they may require medical intervention either at an early age or throughout their entire lifespan. So there's a lot of variabilities, and the healthcare system for intersex people has kind of taken it upon themselves to align individuals to one of the binary sexes. So many people who identify as intersex or have a difference of sexual development may have undergone early surgeries that they never consented to, never wanted, or didn't fully understand the context for. And that's important when we're talking about the differences when it comes to transgender individuals who, unlike intersex people who are born with differences in their anatomy or sexual traits, an individual who identifies as transgender does not identify with the sex that they were assigned at birth.
Hmm.
And so it's important to recognize that the sex that we're assigned at birth is often based on one singular sex trait, our external genitalia, whether you have a phallus or penis or whether you have a vulva. And now that we're increasing access to genetic testing for prenatal pregnancies and things like that, we're starting to see that actually there's more variation in the sex chromosomes. And we're starting to see that we can identify people with these differences of sexual development potentially earlier, maybe before they would have otherwise come to medical attention, if at all. So, transgender people will often, if they choose to, engage with the medical system to undergo medical transition and undergo gender affirming care, which alters their sex characteristics to better align with their identity. And these services are really at risk from the current administration, the previous administration, and just kind of globally, there is an effort to curb access to this life saving care that transgender people often are seeking. Whereas for intersex people, there's caveat in a lot of this legislation restricting access that allows this to continue even though there's a lot of controversy around intersex surgeries. And so while there are differences, there's some connection. So the circles of intersex and trans are kind of like a Venn diagram. So
Hmm.
not all people with intersex conditions will identify as transgender and vice versa, but there is a percentage of individuals who will identify as both. And it's important that we represent the needs of all of the people in all of these communities rather than excluding one over the other.
And it's nuanced, it's layered, it's not, again, the traditional thought of binary this or that, right?
Correct.
And so I think that that's one of those things too that sometimes people don't realize that there are many folks who may not know they're intersex, like you said, until they are in certain developmental milestones or trying to have a family of their own. There are some, that have come up because they've had to undergo certain tests for, I know, like in cases with a few athletes, right? They have to undergo certain types of testing. And so sometimes that can come up. So there's a few different things that you mentioned in your answer about why someone could be intersex. And to me, it sounds like it's not just here, there's this one genetic cause and that's it. There's a lot of different things potentially.
Correct. And there's many things that we don't fully understand yet. So we know that there are lots of different genes that are responsible for initiating the more testosterone driven pathway. We don't actually know what those factors are that initiate those genes at the time that they start. And so there are still factors that we are discovering and how they can play a role in sex determination, but it's really unclear. And when we look at people who have clinically been diagnosed as having a difference of sexual development or identify as intersex, and we do genetic testing on them, about half of them, we are able to find an explanation in their DNA. And then in the other half, we aren't. We
Mhm.
don't know what those reasons are. And so there's a lot of variability. There's a lot that we're still learning about the interplay of our environment, of external exogenous hormones, and how that plays into our development. And then that's not to forget how compounded it is by the concept of gender identity, which is
Hmm.
something completely separate from our sex. So there can be a lot of things that interplay into whether somebody will ultimately be diagnosed as having a difference of sexual development.
And the we plan to have a couple more episodes kind of exploring the topic of gender identity. So some of those we can take a deeper dive into those explanations. One of the questions too that I either get asked a lot or I think I see is very misleading is how common is it to be intersex? Because I think again, as you alluded to with current administration and media bites, it seems like things are maybe more common or I don't know. So,
Yeah. It really depends on the frame at which you're looking at it. So the question about how common it is has been argued by lots of healthcare professionals, lots of theorists, and the issue is really in that definition. What is intersex? And now that we have a better understanding of things like hormones, genes, pathology, our technology is better, we're able to identify more categories. And so you'll often hear the term or the statistic that it is about as frequent as redheads, or about
hmm,
1.7% of the population may have a difference of sexual development. And I think that might be a bit of a conservative number, even
hmm,
though that has also been argued as being an over exaggeration and far too inclusive.
hmm,
So, others will argue that we should really only be considering those that are born with ambiguous genitalia in which a gender assessment or assignment, a sex assignment at birth can't be made. And that's a much, much smaller percent because there are many people with variations in their sex chromosomes who are assigned male or female and will go on to identify with that sex assignment as consistent with their gender identity. So it's not, the 1.7 is more inclusive and it really better categorizes those that have these very obvious differences in these sex traits, your sex chromosomes, sex hormones. But
hmm.
it's important to remember that there's a spectrum for all of these traits. And so on one end, you could have something very severe like cloacal exstrophy, where there isn't a clear genitalia. There's really just one singular urinary, bowel, intestinal tract that there isn't like a vagina or something like that. And then on the other spectrum, like you could have something very, very mild, like a hypospadias. So
Hmm.
cloacal exstrophy is extremely rare, whereas hypospadias occurs in something like 1 in 250 males.
I think I
So,
saw that on a lot of charts when I was working on the clinical practice. Like that was something that came up very frequently.
correct. And
Hmm.
depending on really kind of what you consider to be a sex trait and what you consider to be a variation in that,
Hmm.
puts those people in those buckets. And there's a lot of arguing within the healthcare community as to who should be assigned this way because there's a lot of stigma that's associated with these conditions. And
Hmm.
so I think a lot of people want to remove themselves from the umbrella or even just the near association of intersex as it has been kind of pulled into the LGBTQ plus umbrella. There's
Hmm.
a lot of that social stigma, and people really want to distance themselves and say, no, I am female. I just have this genetic variation that impacts one aspect of my life. And I think that's very valid. But I think we need to recognize that these sex trait variations, whether an individual identifies as intersex or not, are a lot more common than we think, and they don't always impact how we identify or how we're perceived in society.
Right. And I think that also exemplifies that a biological gender is not the same as a gender identity,
Correct.
and that it is up to the individual person to kind of choose how they feel, how they present, or how they want the world to perceive them.
Yeah, I think we have to be really careful about defining gender and sex
Mhm.
as different, and these terms have only really been introduced into the zeitgeist in the 50s, and so we're still understanding the psychology, the reality behind these terms and how we can most accurately reflect them. And so like biological sex, I think it's important to recognize that terminology is often weaponized,
Mhm.
particularly against transgender people. And really, we are all biological beings. We all have these traits and these variations. It's just really whether we fit into these arbitrary categories as they've been defined by healthcare practitioners, lawyers, legal systems, legal structures, etc., societal structures, etc. So those are
Mhm.
kind of the things that I think are really important to acknowledge.
Mhm. And one question I had for you, since you've done working with patients and families of people that have differences of sexual development as well as the advocacy. How are parents, because like you said, sometimes it comes up with a newborn, right? How are parents receiving or taking in this information? Because like you said, there is such stigmatization out there. And it's also one of the things I think about, whenever, like when I was pregnant, you tell people that's generally the next question, right? So I do think a lot of people put too much stock into trying to define boy or girl, right? How do patients and parents work through this diagnosis or this news?
With a lot of support. I think that's the best way that they can move through this because they do get a lot of information. And I think it's important to acknowledge that we are giving them information that is foundationally altering to their understanding of the world and their own identity. And that's why I think so many people have an issue when talking about variations in gender and sex, because we've been so ingrained to believe that there is two explanations and it happens with XX, you go this way, XY, you go that way. And here we are saying, no, 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 it's much more complicated.
Mhm.
That's not the reality, and that's not what you're dealing with. And that can be really shattering if you're not prepared for it and you don't have the support to kind of build yourself up and ask the questions that you need to feel like you understand this information. So I think most parents, their first questions are related to, how do we tell people about
Mm.
this? How do we tell people about this? And what do we do? Do we do surgery? How do we fix this? And I think it's really important to recognize that every individual is going to have a different scenario depending on their presentation. And for some people, there can be very serious medical concerns right
Mhm.
at birth that require immediate intervention. And that is really important. Proper urinary function is key, and we always want to maintain that. So, really helping parents through what is necessary in this moment and what can be deferred until later. Because dealing with an intersex condition is something that requires disclosure throughout an individual's lifetime. Because what you're able to understand at 2 years old relating to men, women, boys, girls, other,
Mhm.
non binary as a 2-year-old is very different than what you understand as an 8-year-old or as a 13-year-old or as an 18-year-old. And so these are constant conversations that parents are going to have with their kid to give them more bits of information about who they are and what their life might look like. And it could be very different than what we've seen with somebody who has the exact same condition but maybe less severe,
Mhm.
or vice versa. So it's really about being there with the parents where they're at and letting them know that they don't have to know everything right now, but that they have the space to ask questions. They may get things wrong. They may make the wrong decision. But as long as they're doing it with as much information as we can give them at the time, and that they feel supported in the decision that will be the best for them and their family, then I think the outcomes that they're likely to have are going to be better. I think my experiences with parents have kind of been all over the place. I've had some parents who were able to take in the information. They maybe had been given initial information that they didn't appreciate. It was handled maybe not the way that they would have liked it to, but when they come to us, they get more insight, they get to ask the questions that they want. We've had some really incredible successes. And I think hoping that families will approach these diagnoses with curiosity can be really helpful. So I remember having a 16-year-old kid who was diagnosed with Klinefelter's, and showing him his karyotype was something that he found really cool.
Hmm.
And a lot of people would maybe hide that information in their medical chart and never show them this extra piece of information, this extra chromosome that they have, this thing that makes them unique. But here was a way to get this child involved in his own healthcare and show, like, hey, this is something cool. This is science. This is in every cell of your body. Yeah, it's different, but here you go. Here's some information. What would you like to know about it? So there can be some really positive, exciting experiences that open up people to a world of personal expression and opportunity, as well as, potentially having a really traumatic experience that requires a lot of psychosocial support, and maybe even, engaging with psychiatric care for both patient and parent. So I think it's really just being able to hold space for parents to be wherever they're at, and hope that they can come to a place of greater understanding about reality and the existence that they're going to now experience.
And you mentioned something with the patient that you were sharing about Klinefelter's. So that is Klinefelter's is when a person has an XXY.
Correct.
And there could be other conditions like Turner syndrome, or somebody has just one X chromosome. So I guess, can you tell us why is it misleading to just define it in terms of XXXY? Because I the question I had was, like, originally I was thinking, well, can somebody be intersex and have XXXY? And I think the answer is yes. So why do we, or I guess I would say the general population, why do they focus so much on the XX and the XY when there are conditions that are fairly commonplace, like Klinefelter or Turner syndrome?
Yeah. So there's a lot of other genes that reside on our autosomes that aren't on our X or our Y chromosome that can impact the function of our sex determination.
Hmm.
And so I think the reason we're so focused on it is really to do with the history of scientific development. So in the 50s and 60s, when we were discovering things like the the chromosomes and the the traits that were responsible for sex determination, we really became focused on the differences. And the biggest difference is our sex chromosomes. So in people that present as male, we have a large X chromosome and a small Y chromosome. People that typically present as female will usually have two X chromosomes, two large X chromosomes, but really only are using one X chromosome. So we started out with a test called the Bar body test, and that could determine whether somebody had two X chromosomes or not. And in people with Klinefelter's, we would see they would have a bar body, but they would also present more masculine. So they kind of broke this rule that anybody with a bar body is female. And so we got better at determining X and Y chromosomes. And I think, again, a reason why we're so focused on those is because we've labeled them the sex chromosomes.
Hmm.
They actually have functions far beyond our reproductive systems. And they have a lot of other functions not related to sex
Hmm.
whatsoever.
And as you mentioned, other chromosomes can impact sex. So it's not just limited to those two. Yeah.
Exactly. And so recognizing that we other possible names were like the odd chromosomes, I forget, but there's a great book called Sex Itself, which goes into kind of the history of sex determination and how we kind of found the science around this. And chromosomes kind of were the original idea about like what passes on traits. And then we got smaller, we found genes and we've kind of narrowed it down further and further and further without expanding our pop psychology around this. So unfortunately, society hasn't kept up with the medical advances that we've been making and the changes that we've implemented, given that we now know better.
One thing I do want to ask about, and you had mentioned it in one of your earlier answers, is talking about surgical, I guess, intervention or medical treatment. I'm putting that in finger quotes for on the audio side. But so one of the things that you mentioned is, so like you're saying, it's nuanced. It's not just this XXXY. So well, I think we know why. It's kind of like you said, that psychological, the identity. When someone is diagnosed with intersex or is shown to kind of show signs or symptoms, is there a push for them to have basically like a gender assignment and a gender assignment surgery if needed? And I understand that's pretty controversial. So thinking about the experts that work in this space, do they see this surgery as like necessary, ethical, or is there a time where it becomes more ethical, I guess, than others?
Yeah, this is, a current controversy that's going on. And I've seen some really positive movement towards patient autonomy around this, but it is still regularly enforced. There's a lot of physician bias as to what a family should do in these scenarios.
Hmm.
And it's really complex. There's no one right answer for everybody. And so the idea of banning surgeries like orchiectomies, vaginoplasties, clitorectomies in young children for trans kids, first of all, those surgeries are not happening on transgender individuals, but they are happening on young children too young to consent, too young to verbalize in some cases who they are. And this is because historically, the management of intersex care has been to hammer a gender identity into a child based on what is going to be the most surgically consistent phenotypically for that child. And so a lot of people will say it's easier to make a vagina than it is to make a penis.
Mm.
And so for many, many children, if you had ambiguous genitalia, because of our limitations in surgery, they may have been assigned a female gender, undergone surgery to best align with that because that's the technology we had available.
And the physicians would be making, I guess, that case or kind of leading parents to make a
Absolutely.
decision and telling the parents, like, you need to
This
make
is
a
what we can
decision.
do.
Right.
Yeah, this is what we can do with what we're presented with.
Mm-hmm.
And often it was, you will do this surgery, you will raise this child in the sex that you have decided, and you will make sure that there is no deviation from that assignment. So those that were assigned female, if they started playing with trucks and, sports, that would be deterred by a parent and the medical team. If there was sex and gender dysphoria, that would be blamed on the parents for not doing good enough job of reinforcing the gender identity into the patient.
Mm.
And we've realized that you can put somebody in a box, but as soon as they have the autonomy and the freedom to express themselves genuinely, that might not be the box that they exist in. And it's a small percentage, but this idea that we can reinforce these beliefs as long as there's nothing incongruous, and I say that in air quotes, to confuse the child. And that was, again, a big reason surgery, if not performed, it will confuse a child to have an enlarged clitoris. It'll make people uncomfortable. It'll make babysitters uncomfortable.
Hmm.
It'll make other family members uncomfortable. And that's still pushed. A big one. For me personally, I think hypospadias is a really big issue. It's pushed on infants between 18 months and 24 months is kind of the standard recommendation for moving the urethra of a child where the urethral opening is not at the end of the penis, but maybe somewhere along the shaft.
Hmm.
And the biggest justification, the most frequent justification I heard in my time was this will allow them to pee standing up. And what's shocking to me is I had families come to me who said, why would you pee standing up? Socially, in
Hmm.
their cultures, that was not a masculine thing, but it's touted as being a really important thing for somebody's masculine identity.
But it's not a medical necessity.
It is not a medical necessity. And the research that we have shows that the procedures, the outcome of the procedures, the success of the procedures is considered pretty equal depending on, like, regardless of when you do the surgery. If you
Mm.
do it young, the difference is they may not remember it. And I think we're putting a lot of faith in that they will not remember it and that they will not be impacted by it. And I think the experiences of a lot of intersex people has been that they do remember it.
Mm.
And if we are going to engage in patient autonomy and, these trauma informed collaborative principles, we have to be honest about what a patient has experienced in their lifetime. We can't hide the fact that they underwent a surgery because that surgery could have complications for them down the road. That
Right.
they may not then know what is going on with their body because somebody has hid something from them for their life. Somebody that they trusted, somebody that they were supposed to trust, a healthcare provider. So these are all things that need to be taken into account when we're thinking about surgery is, can this be delayed? Can we engage in patient autonomy, patient input? Or is this medically necessary to engage in right now? And, like I said earlier, there are scenarios where interventions are absolutely necessary. Safety of that patient is extremely important. And there are scenarios where patients are not safe in
Mm.
families if they do not conform to specific sex presentations. And unfortunately, it is not our place to be able to determine, how that plays out. And we can really only engage with what we can to provide the best outcomes for that patient. And that might be doing something that individual is later going to regret and be upset about. But it's a balance of patient and parent autonomy and
Mhm.
really having that be allowed. And I think we want to give people as many options, as many choices as possible. And when we start with surgery, we can't, it's very hard to undo the things that are taken away.
Mhm.
So I think it's really important that we consider all of those options.
Mm.
But they are happening, these surgeries that people are concerned about, but not nobody, very few people seem to be concerned about the intersex infants that are experiencing this push to conformity. These things are not happening for transgender patients. So even though there's kind of like a battle of who gets treatment versus who doesn't, we need to kind of come together to support the needs of everybody and making these services accessible for all who choose to engage in it. We can't kind of throw each other under the bus and create these carve outs and caveats for
Mhm.
intersex people only or people who have access to genetic testing and are born with variations in their sex trait that allows them access to care. And we can't absolutely limit surgeries because we gain so much knowledge from these surgeries and have really gotten a lot better at these surgeries. So the the success rate, however you determine that, whether it be sexual function, patient satisfaction, those are improving with time. They're not 100%.
Hmm.
The regret rate of both in parents and in individuals who have undergone sex conforming surgeries, there's more than 50% or close to 50% express regret rate. Whereas with transgender individuals, that regret rate is less than 1%. And in those that there is regret, it's often related to, again, the societal response to transition. So I think kind of those things are important to hold.
Yeah, and I think that's what is clear is that it's personal situations. It's working with healthcare providers that can understand that have the trauma informed lens that they can work through, but then also this psychosocial, psychological background as well to navigate it. And so to me, that speaks volumes to say this is why we need specialty clinics like the ones that you've been a part of and that some of the other genetic counselors work in, because we need to have people that are experts in this type of care and that are well versed in it and know what they're doing. This is not typically somebody for like a general practitioner. And so that kind of leads me into the concern that maybe we won't have these clinics or we won't be able to have more of these clinics potentially that might be needed. And part of that is due to some of the legislative bills. So I'm hoping you can talk to us more about these bills that are being introduced that really do harm to both transgender and intersex communities. And they really weaponize these misconceptions, right? Like it's just XX or it's just XY to really influence policy and law. So they're really trying to influence the infrastructure of healthcare.
Yes. And there have been 859 bills this year that have
Wow.
been introduced to restrict access to medical care, participation in sports, etc. It's really unfortunate. It's really terrible. And it's like I said, it impacts cisgender people more than it impacts transgender people because transgender people, intersex people, they are a very small percentage of the population. But when you start defining womanhood, you open up every single woman to inspection.
Hmm.
And we have seen this. And these laws are really being introduced to redefine womanhood because there's very, very little that's being done about trans men and the access for trans men into particular spaces, particular sports. And that's because there's a belief not only about there being only two genders, but there being a superior gender biologically. The biological determinism that exists, we see it when you start excluding trans women from playing chess because apparently there is a advantage
Hmm.
to being a trans woman in chess. And that really sets the precedent that women are just not as smart as biological men, in quotes. So, that's one aspect that they're using this legislation to harm intersex trans people and women, cisgender women. But they're also using this legislation to scare healthcare providers. So there's legislation being introduced for, life penalties in prison for providing gender affirming care. And I think it's important to notice that the terminology in this legislation is very clear that it's specific to transgender people. If you identify as cisgender, you are more than welcome to undertake gender affirming care. And we see the majority of mastectomies performed on XY or presumed XY males, 98% of them identified as cisgender males. So these surgeries, they are happening,
Hmm.
but there's caveats for, okay, well, how you identify is the determining factor. Not and that really dehumanizes and devalues an individual Because
Mhm.
it's saying you can get this surgery, but you have to pretend to be somebody that you're not. You can still alter your body if you would like, you just can't do it in this way. So it's really, creating this inequality under the facade of protecting people,
Mhm.
protecting children from making irreversible decisions, when the data shows that the majority of young children who identify as a different gender than the sex that they were assigned at birth will go on to have that persistent idea. Whether they go on to transition is a different question, but they will continue to have that perception, that belief. Very few children will grow out of that. And vice versa. There are very few people that will, later in life change their identity, but they exist and they're there. And
Mhm.
it's important to acknowledge and respect them and give them the same amount of access to services. But unfortunately, legislation is really coming for us as healthcare providers as well. And it's really trying to redefine the scope in which we practice and redefine the way in which we talk about sex
Mhm.
and the way that we understand it, which is so far against the reality of our environment. So I think it's, this is one kind of thing that I would say is a call to action is a lot of legislators are getting information from these cut copy family focused or religiously affiliated groups that are pushing this legislation, and we have to actively combat this belief system, which is rooted in white supremacy and eugenic belief systems. So we have to be the ones, the experts, to really go and say, no, you're not thinking about all of these X, Y, and Z scenarios. And it's really
Mhm.
important that you understand it. When legislators have a chance to ask questions, they start to realize, oh, I didn't understand this the way that I thought I did. And they're less likely to engage on passing that kind of legislation if they have insight from experts and from people that can really tell them what the reality of healthcare is for for these populations, not just these populations, but for all people.
Right, right, and to bring that expertise that they have, again, as someone who probably has gone to many additional years of schooling, right, and has worked in this area and worked with the patients, worked with the families, because I'm going to imagine the vast majority of legislators don't have this kind of background, so they need to be able to hear from the experts. And that leads me into some of the questions I was gonna ask, which are really just how can we as healthcare providers support advocacy for intersex folks? How can we just honestly, as people out in the world, be an ally and advocate?
So I think the best thing you can do is listen to intersex people, listen to affected individuals, listen to a wide range because, like I've mentioned many times, no experience is the same. The group of people that identify as both intersex and trans, the people who, identify as female, consider themselves, their gender identity is not in any way informed by their sex traits. Listening to what everybody's needs in the community is really important because then you're going to have a well-rounded practice and be able to meet the patients where they're at with what they need. And then I would recommend listening and always speaking out. Always bring intersex to the conversation. And that I think was kind of my biggest thing was whenever we talk about men, women, always bringing up, well, are we including intersex people? Are we including transgender people in this conversation? Are we
Mhm.
including their needs? And so always be that squeaky wheel in the conference, in the journal club. Oh, they didn't include non-binary people. They didn't include transgender people. They didn't ask about sex differences. Thinking about those kinds of things when we're evaluating information. So looking at things with a broader lens and a
Mhm.
more reflective lens of the reality. So just really listening and speaking up and just kind of making sure that there's representation in the room. and not having for it to always be on the person who's affected. I think that if you are a cisgender white woman, you have so much power in this space to show that you can be an ally, that a trans woman's existence does nothing to harm or devalue, delegitimize your existence and your experience as a woman. It is merely a different experience, but it is still valid and valuable. And so if you can be the one to say this is important, you're protecting trans and intersex people from having to out themselves in a really, really unsafe environment that
Right.
currently exists. So I would really encourage, if you have privilege, to really use that and speak up and put your hand up. It feels uncomfortable sometimes to be the one to say, like, have we thought about this? Have Because
Hmm.
chances are, no, we have not. And
Right.
so you're always pointing out, you haven't thought about this. You're not doing this. Sometimes that is hard to be that person, but it is really valuable, and it will make you a safe person to other people to come out to.
I appreciate that, and I can tell. I mean, definitely your passion comes through, but I appreciate the call to action and how folks that are maybe in the majority, or like you say, are privileged and are maybe not facing some of the things that are going on as much. This is the time to be able to use that voice to speak. If if our listeners, I mean, we've covered a lot of ground, which I think is great, and I appreciate you taking the time. If there's one thing that people can remember or take away from the conversation, what is it that you hope stays with them?
That there is so much that we have yet to learn, and our differences, our different experiences should be valued, and we are so much stronger together than we are tearing each other apart. And so I would really encourage people to question what you know about sex and gender, and why you think that certain things have to look a certain way in order to be valid and respected. And if you can't find a good enough reason, then, bring that into your daily praxis of, engaging with people without assuming gender. Really allow for yourself to experience the full range of masculine and feminine. Don't don't cut yourself off from experiences because that's not ladylike, or that's not masculine. We really harm ourselves when we limit ourselves like this. And so, I hope people can see the gift that intersex and trans people are to us. I use the term endosex, people who presumably function as expected in the typical quotes, male and female as determined again by Western media, Western medicine. But just to really, yeah, really question it, really keep an open mind, and really appreciate the gift of people who express authenticity in every aspect of their life, even though it comes at such great a cost to them.
And I think that can be helpful for folks that, like you said, are have never thought about this, have never encountered this, is to say, what can I learn from this? And like you said, getting curious and look your day to day, because you may not think it influences some of the decisions that you make or some of the things that you encounter, but it really does when you take that step back and kind of look at it critically in terms of,
I think one thing that we should uh, actually, I will change my answer. Is that the one thing that I think is important is that, as genetic counselors, we should be talking about sex in a much more inclusive way. So that should somebody incidentally find out that they're intersex, they were prepared for this possibility. They were informed that it's not just XX and XY, it's more expansive, there's more options. So those are the things that this is a change that we can take into every single encounter that we have, not just for our intersex or transgender patients, but for every patient that we have that will
Mhm.
benefit not only our cisgender patients, and our cisgender and endosex patients, but our intersex and transgender patients as well.
Well, thank you, Kaitlyn, so much. I really appreciate your insight and the conversation. And honestly, I think we could probably go on for another hour. But
For sure.
I will wrap it up and just say thank you so much for being here today.
Thank you so much. And just to wrap it up, I want to shout out a few resources that might be helpful to your
Definitely. Yes.
listeners.
And we'll put them in the show notes as well, but go ahead and say them now.
Fantastic. So, Interact is a wonderful intersex led advocacy and legislation group, as well as the Intersex Justice Project, who does a lot of action and advocacy. They're one of the co creators, Saifa Wall, has started a group called the Strategy Lab for Intersex Movement. And they're actually going to be presenting with other healthcare providers and advocates about the legislation and how we can be better advocates. They're doing a webinar today. So I will share their Instagram so you can find that information should you be interested if the timing works. But those are groups, as well as Interconnect for peer support, are fantastic groups. So if you ever need resources, those are some of my top friends.
Perfect. And we'll put those in there as well as a link to the webinar. Thank you so much, Kaitlyn.
Thank you so much, Kay. I really appreciate you taking the time to talk about this topic.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening and join us next time.